Million females worldwide have this condition, and still it's not completely understood, and we don't even know for sure what causing it. Polycystic Ovarian Syndrome, or PCOS, is a condition caused by a hormonal imbalance. But don't think that PCOS affects only reproductive health. No, females who have this condition, they are also at a higher risk of diabetes type 2 and of heart diseases. When it comes to PCOS, there is no one-size-fits-all set of symptoms. Some might suffer with infertility, and another one might have acne and excess hair growth. And it's not really helping us with the diagnosis, right? We have 3 criteria, and if you have at least 2 of them, you will be diagnosed with PCOS. And now let's talk more about it. First one is irregular cycles and ovulatory dysfunction. Irregular cycles is a definition which will vary, and first of all we should remember that having irregular cycles is normal in the first year post-menarche. Menarche is the first menstruation in girl's life. Okay, if you more than 1 year and less than 3 years post-menarche, it's okay for you to have cycles shorter than 21 days and longer than 45 days. If you are more than 3 years post-menarche and to perimenopause, irregular cycles is when your cycle is less than 21 or longer than 35 days, or you have less than 8 cycles per year. For those who more than 1 year post-menarche, irregular is when they have longer than 90 days for any one cycle. So when irregular menstrual cycles are present, a diagnosis of PCOS should be considered. Remember that ovulatory dysfunction can still occur with irregular cycles, and if we need to confirm an ovulation, the good way is to measure the progesterone levels. The next criteria is hyperandrogenism. Hyperandrogenism may be biochemical, which means that you don't have any symptoms, any visual signs of hyperandrogenism, but you still have a high level of androgens in your blood. And another type of hyperandrogenism is clinical hyperandrogenism, which means that you have visual symptoms and visual signs of this problem. To assess biochemical hyperandrogenism in the diagnosis of PCOS, it's recommended to use total and free testosterone. If it's necessary for you to assess a biochemical hyperandrogenism, but you are on the combined oral contraceptive pills, then the pill should be withdrawn for a minimum of 3 months and contraception should be managed otherwise during this time, because it's very difficult to reliably assess for biochemical hyperandrogenism in women who are taking combined oral contraceptive pills. The presence of hirsutism alone should be considered predictive of biochemical hyperandrogenism in PCOS. And female pattern hair loss and acne in isolation, which means without hirsutism, are relatively weak predictors of biochemical hyperandrogenism. This hair growth on your body or face in a male-like pattern is also known as hirsutism. That means that you might have thick and dark hair in the areas where females usually don't have hair growth. People might have different opinions on what is usual and what is excess hair growth, so to quantify hirsutism, we use a Ferriman-Galway score. In the method, we rate hair growth in non-body areas, which are upper lip, chin, chest, upper and lower back, upper and lower abdomen, upper arms and thighs, and we are rated from 0 to 4. Ferriman-Galway score of 8 and more is considered a diagnostic of hirsutism. And the third criteria is ultrasound and polycystic ovarian morphology. Follicle number per ovary should be considered the most effective ultrasound marker to detect polycystic ovarian morphology. We don't have to see both follicle axis and ovarian enlargement in one patient to talk about polycystic ovarian morphology. That means that we might tell that patient has polycystic ovarian morphology only if we see follicle excess without ovarian enlargement, or vice versa if we see ovarian enlargement without follicle excess. And it's not necessary to have both ovaries changed. We can see ovarian volume equal or more than 10 milliliters of follicle number per section, more or equal 10 in at least one ovary. Thank you for watching this video. See you in the next one. Bye!